All right. Hi, Hannah.
Hi, how are you guys?
Good. How are you?
So good. Thank you for having me. I'm excited to talk about this today.
Yeah, we're excited to have you. I feel like I always learn so much from just having, like, talking to doulas and getting ideas. So I'm sure everyone is very excited to hear from you. So, yay.
Yeah.
Well, tell us a little bit about you and just kind of your business and what that looks like.
Yeah. So I started as a doula 7 years ago, and I trained with Doula Trainings International because I was really the only one at the time that was longer than a weekend. It was like a year-long training. And
Nice.
I just, I mean, I had already had one baby of my own at that point, and I was like, this is a really big deal. Like, I want to know all the things about all the things as I prepare to guide parents through this extreme and
Yeah.
transformational experience. And so from there, I have trained with the Rebozo. And so learning about that and how that can be incorporated into the birth space.
I love that.
And then I've also done women's embodiment leadership. So just learning like how to connect to the body and skills in that. And I think that really deepened my capacity to also hold space,
Mhm.
um, and just guide people on this journey, because birth is not a one size fits all. Like you do these, and these things. It's a very much a unique journey for each mama and family that goes through it. Um, and so I serve families as far as birth and postpartum support. I also do mother blessings, which I think helps bring kind of more that sacred element into this experience. I've done them for like 10, 12, 10, 12 friends of the mama, and then I've done them for like two or three other ones. So
Oh,
they can be really big, really small. And then I also have the Mindfulness Childbirth Course, which is where we really just dive into how do we kind of connect all these dots and set ourselves up for a really beautiful and aligned experience. So we can connect to the body, but also do all the practical things that we have to do on this journey too. So
yeah, that's awesome. Well, having met you, I just know that you're like energy, and even over Zoom, you can feel it, but you're just very like calming and everything like that. How do you like instruct your clients, or how do you work with people to bring that energy into their birth? Because it's very anxiety producing, especially if
yeah.
you haven't done it before, or I mean, that amount of you just don't know what it's going to look like for you. So how do you stay calm, and then how do you kind of bring that into the birth?
Yeah, I think I kind of broke it down because when we were going to talk about, yeah, just creating calmness as
Yeah.
you prepare to have a baby, I kind of broke it down into three things. As far as first, education. I think just learning what is going on in our bodies is huge, because if you have no idea all of the things that your uterus is doing, then yeah, as that sensation starts, there's a lot of fear of the unknown, of like, how is my body going to get this baby out? What are these contractions going actually doing?
Yeah.
What is a natural normal rhythm? And how does that change throughout the birth process? I think is really important to know. And it's important for partners to know too. I
Mhm.
have a lot of times partners are like, oh, it's your body. Like you need to know it. But it's like, no, but you're supporting her.
Yeah. Yeah.
So you also need to understand what this looks like for her, because you need to be able to look at her and be like, you've got this. Like you can totally do this and actually know that in your body. Um, so I think first of all, just education, just learning the
We feel this.
sensations of the body.
Yeah.
Yeah, what's
Yeah.
happening. And I think that's also what I've loved working with you too, is that was one of the big things with you, is like we're learning about the pelvic floor, we're learning about this. And I think that we're just so disconnected from our bodies on a daily
Yeah.
basis.
Totally.
So,
Yeah.
and then the other one was gathering a supported and aligned team. And I think that's so key, because this is such an intimate time. And so you really want to have people that you feel comfortable crying in front of, you feel comfortable bringing your thoughts, concerns to, and you feel really heard by them. Um, so that can be anybody, whether that is your OB midwife, like you should have a really good relationship with them. Even if they have other doctors or providers that could be on call, you're wanting to cultivate that relationship with them, so that a lot of times, if you have a relationship with your provider, they will call and advocate for you to that provider that's actually there present with you.
Yeah.
Um, and that can be really nice, just to hear the doctor in the room saying, hey, I spoke with your doctor. She said all these things about you. And then you feel really known by this unknown person that might be coming into your room.
Yeah. That's
And then yeah, even just anybody you put on your team, you should feel really comfortable with them. I think that obviously hiring a doula is awesome because they can help kind of those questions nobody's asking you.
Yeah.
You know, I mean, everybody asks you like, how's the nursery coming or how are you feeling? But, you know, nobody's asking you like, how are your appointments going? Are you feeling really heard by them? Do you
Yeah.
understand what these tests are that they're offering you? Um, so yeah, it's really just building that team that you feel really heard by and having somebody to ask you those questions that maybe nobody else is asking you.
Yeah.
And then the last one was just creating safety and resiliency in your body. Again, I really come at this body centered as far as like we're getting to know the body, what these new sensations are, because you know, your body changes so much throughout the pregnancy process
Yeah.
and then so much postpartumly too. And so it's really creating that connection of, okay, I can create safety in my ever changing body and know that there's still this person inside of me that isn't changing. Like there's still just me here underneath all
Right.
of this.
I love
So,
that. That's really
yeah,
cool. What are some like things you do to help people connect there? I'm just so interested because
yeah.
we do kind of similar things from a PT perspective, but yeah, I
Yeah,
think it's really
that's one
cool.
thing that I've loved. Yeah, working with you because you would always turn it back around to me, be like, well, what's going else on in your life? Like, where's all the other things and the stress? And I think it was so funny because, you know, I mean, you can know all the things in your head, but then logically to apply them to yourself, it's like,
Totally.
oh, okay, so my stress is related to my pelvic floor, you know, even though you
Yeah.
know that at a logical level.
Yeah.
Um, and so the things that I really love to cultivate with families is just, okay, what allows you to kind of exit this outside world and then come back to calmness within your body. For some people, sitting in meditation, like that feels really good for them. For others, that feels impossible.
Mhm.
And so for them, I would suggest, you know, getting outside and walking. Maybe it's a walking meditation. Maybe it's just music that you love, but some space where you can kind of turn off that mind, allow that kind of like undercurrent of your thoughts to come forward so you can kind of be like, okay, like these are things that are in my mind right now. Check in with your body. In the Mindfulness Childbirth Course, we really talk about it in the beginning, like these are sensations you might feel in your body, and I want you to really know when you're feeling them. Like when we're talking about pushing a baby or when we're talking about transition,
Yeah.
when are you feeling that like tightness in your chest or that like bubbling underneath your ribs, and really noting that because that's your body saying, ooh, this feels really uneasy and I either need more support, guidance, or yeah, just more education on what's going on during that phase.
Totally.
um, so really it's just connecting with each family. The Mindfulness Childbirth Course, I moved it all online last year, which is
Nice.
really beautiful because I'd been doing it for the last 4 years. And it was nice to meet with families and be like, oh, you already know all this stuff. Like now we just get to have fun and like really dig
Yeah.
into what came up for you. And so that's been really cool to witness them being able to get the information, connect to their bodies, and then we get to kind of dig deeper on like, okay, what felt uneasy to you? What would a practice? Because I think I really encourage clients to have at least 1 or 2 times a day that they kind of just come back into themselves. That could be easy as like setting an alarm on your phone and it just says breathe, or maybe one of your affirmations. And yeah, the breath can be as easy as like a big inhale. And you just do that like 3 times
Feels
just
good.
until you just until you feel your body just like relax into
Yeah.
it. And I think doing that throughout your day really helps you to kind of come back to that centered spot because man, we live so much up here and all the things,
Yeah.
and we can get so carried away with that. So
Yeah. What a good
them
practice for like life, honestly. Just,
yeah.
like continuing even into postpartum, being able to just already have that skill and that habit would be so helpful to just kind of like reconnect and be like, okay, who am I? I don't know. You just lose yourself so easily with all the stuff going on.
Mm,
And yeah, so I love that. That's great.
yeah. That's so true. And I love that. That's one thing that I really was wanting when I built the course was I don't want you guys like learning or practicing these things that aren't also life skills that will benefit you in postpartum and beyond.
Yeah.
'Cause I think as you prepare for birth, it's like, oh my gosh, I have to do all these things. And that can feel really overwhelming.
Yeah.
Um, so it's really like just chunking it down. Okay, what skills are going to really help me during
Yeah.
birth? And I think unmedicated birth, really knowing how to stay in the present moment and stay in your body, as opposed to getting swept up in the story of how long have I been here? How long was this going to take? Like, that's really huge. I think that that's a majority of the skill in having unmedicated birth, is being able to catch that and be like, "Oop, no, we're right here in this moment. This
Yeah.
is our rest. We're not thinking about this next contraction. We're going to be right here. And how can I bring my body into this moment and enjoy that rest?"
Mm-hmm.
Because if you think about it, when we're moving through labor, we are resting longer than we're contracting, because we're contracting for that minute and a half, and then we have a
Yeah.
beautiful like 4 or 5 minute break there sometimes. And so I just encourage mamas, like, if you can be there in that rest, then you totally can do this.
Yeah.
Um, and so, like you said, postpartum, there's going to be those moments, and parenthood in
Yeah.
general.
Yeah. Yeah. Mm-hmm.
Yeah, because you guys all have children, so you
Yeah.
totally get that of like, yeah, you need those moments when you realize, okay, I just need to pause and collect myself and come back to my body and be like, okay, what's really important right now? And just have that recentering moment.
I love that, focusing on like the rest portion more than like I feel like so much of it is like how do I get through the pain, but it's
Mm,
really how do I like, if I'm hearing you correctly, like how do I maximize my rest time, which is
yeah,
such a mindset shift. I love that. Um yeah, because you're like, oh, focusing on the rest instead of the minute and a half that's painful.
yeah.
So
And that's why I really love breath. I always teach my clients
yeah.
starting out with 3 cleansing breaths. So and just feeling that. And usually, if you're doing those nice and slow, you're about a quarter, if not halfway through that contraction by the time you've finished that third one. And so
Ah,
then you're like, okay, this is probably the hardest part. So then I'm going low and slow. And then as that contraction comes to an end, like, you just let it all go and you allow yourself to let all of that go and realize, okay, I'm right here in my rest and being right here. Um, and I think the more you practice that, the more easeful it is.
mhm.
Um, I know when I first started, I did hypnobirthing, and that was one thing that I really cultivated and kind of pulled out of that, was that just the power of your mind and how the perception you create for yourself really does create how you see the world.
Yeah.
Um, and so really, really getting clued in on what that is for you.
Yeah. How do you, because I think we hear a lot of people that are, which is great. They go into birth being like, I'm open. I would like to pursue unmedicated, but I'm totally fine if my body decides it needs an epidural. How do you kind of help people make that decision in, I know this is a lot. I don't want to get, I want people to
No,
use
but
this,
yeah.
but is that, do you find that people, I guess, do you know what I'm kind of asking? I guess
Yeah, I feel like that's
that
really
decision
common.
making process is hard. We always prep them for unmedicated, but yeah, I,
Yeah, I think that with that, we really get into, okay, well, why? Because I think that in order to do something really hard, if you're doing, a triathlon, or if you want to climb a mountain, anything really hard, you have to have a really good why.
mhm,
Because in those hard moments, you'll be like, okay, never mind.
mhm,
And I know for me, the first time my husband was like, you just have to take it off the table. Like, the epidural is just not an option. He's like, if you know it's there, you'll want to take it. And so for me, that felt really good to be like, I'm just doing this and I'm setting my mind up for it.
mhm,
I also really allow women a lot more flexibility in the room of saying, you don't know how this is going to go. And so you
right,
always have that moment when, you can see you're not able to come into that relaxation. And that's really
yeah,
key. If you're not able to be in that relaxation, that's when we're getting into suffering, because you really are really being overwhelmed by the sensation. And
yeah,
you're not in your body at that point either.
yeah,
And so really telling mamas that, like, these are things that we look for when you, and dads too, like, if when you see that tension during birth, like, we're trying to guide her and how can she relax that and be in this rest.
yeah,
um so back to your question, really just getting to their why of like, why do you want to do unmedicated?
mhm,
And then they kind of get to discover, okay, is this something I really want? Or is this something that I feel like I should want? And then also helping them get really clear on their team. Because I think if they have a team that's super supportive of an unmedicated birth, that feels more easeful for them. And I think once you get to know how the body works with unmedicated birth of how can I set this up, then that really helps because it is really those tiny things that will help you get through it as far as, just not being bothered. I remember most of the times as, providers will come in, the moms just look at me like, well, can they just leave? And I'm like, yes, and that's why you have your team around you so that they can kind
Yeah.
of create this bubble. So you can just go into your bubble of labor land and then come out when you want to come out.
Yeah.
So I think really just getting to the why of like, why do you want? And I love that you said you prepare them to have an unmedicated birth because
Mhm.
I think that's really key is you just don't know how birth is going to go, and having those skills of how do we navigate birth and how do we find comfort in that and support from our
Mhm.
partner and from our providers, like that's key because I mean, sometimes the epidural doesn't work. Sometimes there's a window of pain. So knowing how to also find comfort in those things is
Mhm.
really important. So I do the same thing. We're preparing for an unmedicated, but then we're also setting ourselves up for, okay, these are the things that we want to look for when we're ready for that epidural, if we want to keep it on the table.
Mhm.
And just having that conversation. Cause I mean, I've had mamas that will be going through and then they're having a hard time coping. So I'm like, do we want to talk about the epidural? And she's like, yes, I just want to do it. And they'll get that bag of saline in. And then she looked at me and she's like, no, never mind. Can I not do this? And I'm like, absolutely. So it is so much about just needing the permission to move through this experience however you want without judgment. And I think really discovering what that is for every person, because not everybody wants to have an unmedicated birth, and
Right.
there's nothing wrong with that. I think you'll be most satisfied when you're choosing to navigate it in a way that feels most aligned with you personally, not with how social media, your best friend, or your mom did it.
Yeah.
So yeah, I think just getting really curious on like, well, why do you want that? Because while I love all of the things about unmedicated birth and how wonderful it is, I also think that can be really disheartening for women who maybe don't want to have an unmedicated birth. Then they
Yeah.
would be like, well, okay, all these women are doing it. Like I should want to do it.
Sure.
Um, and so I think it's really important just to have a good why, whichever way you go.
I love that. That's so good. How do you, I guess, if someone does choose to have an epidural, are there things they can do to still be in their body, or like that you instruct them on to like, okay, just because you have an epidural doesn't mean you just get to like peace out and and just, then it's over. Like there's still
Yeah.
a lot there. I think that's sometimes what I hear people say too is like, well, I'm just gonna get an epidural, so I don't need to worry about it. And I'm like, well, there's still a lot there.
Ah.
We specifically go over like pushing and how to even kind of breathe through that, even if you can't kind of feel.
Mm.
But are there things that you have people connect with? I love how you describe like mindfulness. Are there things you have people do once they have the epidural, or when the monitor tells them they're having a contraction, or things like that? Or
Yeah, I think that there is that notion of like, oh, I'll get the epidural and we'll turn all the
and
lights
it's
on and
fine.
we'll watch TV and I'll take a nap.
Yeah,
And it's like, no, actually, we're still going to keep the lights really low. Like, if you have
yeah,
a good meditation or music you want to just put in your ears. And I think epidurals are best used when it's like we're resting because, like
yeah,
you said, they're still pushing and that's really intense and really exhausting.
yeah.
So how can we use this epidural to really rest? And so even if that's like an eye mask, if that's earpods, so that they're really able to just zonk out. And I even encourage dads too. I'm like, if she's sleeping, like you need to be laying down and sleeping too.
Mhm.
Because yeah, like you said, pushing is still really intense. Even with an epidural, they can't block all the sensations.
Right,
So there's still a ton of pressure.
right.
Um, and so I think I've actually had a lot of moms that can actually feel towards the top of their contraction, even with the epidural, especially as baby gets lower, you can feel that
Yeah,
pressure begin to start at the
yeah,
beginning of the contraction. And so I think it's just cluing mom back into like, hey, like, what are you feeling right now? And reorientating everybody to her instead of reorienting everybody to the screen.
yeah,
Um, because I think that we do get caught in that of like, oh, your contraction's starting. And she's like, really? And
yeah.
so then just checking with her, well, what do you feel? Like, can you start to feel it yet? And if she doesn't, I've had moms with really strong blocks that can't feel it. And so then we are looking at the screen, but also I'm telling her, you're pushing with your body in the sense of when you can't push anymore, like take that big breath and like come back to it. You aren't purple pushing, you're not pushing past your body.
Mhm.
We're still checking in with the body because I think that's the hard thing about epidural is it does kind of shut off your body connection. It's
Yeah.
like my body's going through this, but my brain is not anymore.
Mhm.
Um, and so it's just reorientating everybody in the room back to her
Yeah.
and her experience because even though she has an epidural, she's still going to be able to tell us more than those monitors are
Yeah.
as far as how she's doing. And um, I think that feels really good to a mom to really have everybody be
Yeah. Focus on
um,
her. Yeah.
focusing on her instead of that outward information overriding her experience.
Yeah.
So,
That's awesome. That's really cool. I just feel like it's so powerful to have someone in the room like a doula who can be that advocate throughout the
mm,
that's just yeah. Yeah.
yeah, because I mean, everybody there that's supporting you, like that's their 9 to 5 job. And
Right.
so not only are they thinking about you, but they're also thinking, I also need to do all these other things. So they don't really have that capacity to like check in with you emotionally and see how you're doing. And most of the times while moms start pushing, like the nurse is still at the computer, And so it's like, how can we reorientate everybody to you? And I think that it's really easy to do that. And once everybody notices it, they're like, oh, wait, why aren't we paying attention to her?
Right.
And so it is just that one person in the room to kind of shift everybody else.
Mhm.
Um, and even the dad too, of like, no, like just watch her go through a contraction. You can see when it's starting, when it's stopping.
Yeah.
Um, we don't have to look at the monitors. They're great to have. And I think it's super helpful that, to have that technology to be able to do that, to see baby's heart rhythms. I think that's really good. But I think also we need to still look at mama because she's going to tell us a lot.
Yeah.
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 What it seems like to me is that the other like providers, the nurses that are there are like a little bit more outcome driven. Like we're getting
Mm,
to baby and we're trying to
Yeah.
get to baby. And what it sounds like is like having that other person, a doula in the room is like, let's also like pay attention to the whole process. Like all of it
mhm,
is important, not just the outcome of the birth of the baby, like I
mm,
love that you're kind of teaching women like let's stay in every stage of
Mhm.
this and like what is it for you at each stage so that the whole thing is like labor and delivery and birth versus like just the outcome and we're just like waiting for the outcome to
Yeah.
occur.
Yeah.
I think I like that like your perspective is more like all of this is important.
mm,
Embody the whole thing
Mhm.
throughout the process.
Yeah, because I think for so many women, it's like, well, I've had a rough birth experience potentially, but then I'm healthy and baby's healthy, and so none of the rest of it
Right.
matters. And that's not true because it's like, well, it is a
mm,
whole experience, like just because you climbed the mountain doesn't mean it was easy, or like you
yeah.
didn't, I don't know.
Or there wasn't
It could have
value
been
in the
better. Yeah.
mountain climbing.
Yeah.
Yeah, because so much of it is the actual journey of birth because you're
Right.
able to witness yourself building resiliency and building trust within yourself. And so when other people in the room doubt that trust and even just the things that can be said, that's why we're always talking about, how does your provider make you feel? Like, what are the things that they're saying? And sometimes parents don't even catch the things. And then they'll tell me what they said. And I'm like, no, but you are allowed to go past 41 weeks. I was like, we should be having more of a conversation of what are your risks on going past? Like, you are allowed. It's your
Yeah.
choice 100%.
Yeah.
And so there's just those tiny red flags with providers that I think once parents are educated on them, they're like, oh, wait, like I'm not in the driver's seat. This provider's in the driver's seat.
Yeah.
And even just them, I mean, those are things that moms remember is they remember the provider coming in and saying, oh, she's not ready for me. This baby's still a long ways away. And when you're pushing, that's
Yeah.
not what you want to hear.
Oh, oh,
And
it gives me.
so we're doing that groundwork before of like, okay, these need to be really wonderful individuals that you feel held and trusted
Yeah.
to have your baby with.
Mhm.
And
Not
so I
like
think,
to autonomy, I feel like would be really
yeah,
negative,
Yeah.
if you don't feel that.
Mhm.
yeah, and that's the number one reason or number one way that women are satisfied with their birth is if they felt like they were at the center and they were heard and seen in the experience.
Yeah.
Yeah, and that's honestly my like guiding light throughout all of it, no matter how it goes. I've had moms have, the cesarean they didn't want, but because they were able to have that moment to grieve that experience before going into the cesarean, and they were able to have me and the dad next to them, holding them through that, it was a lot less traumatic because there wasn't that moment of leaving their body. It was, okay, I'm going to be here and feel all these feelings right now.
Yeah.
As much as we can, as much as we have the space to. But yeah, I think that kind of just coming back to those three of like really gathering your people, understanding your body, and then what are we doing on a daily basis to really build that safety and resilience in our own bodies. Because yeah, birth, you got to keep going even when you
Yeah.
don't think you do. And that's even with an epidural, you'll still hit that wall of like, I cannot do this. And
Yeah.
you have to know that birth will take you just beyond that point you think you can go. And that's really the whole point. It's making you see that as you step into this season of a ton of responsibility of being a mother, you know that your capacity is expandable and that you can go right past that point where you think you can go. But we're also teaching like the self-care and cultivating that within the pregnancy of like, okay, how can I hand off things to my partner? Because I think that as women, having that ability to expand our capacity and move through really hard things is really cool. I also think we still have to prepare our community around us of like, okay, but also I'm coming home with a baby and these are all the things get to take care of because I'm focusing on healing my body and taking care of my baby. So that's also something we really talk about is how are we handing things off? I think with second babies and third babies, you do that a little bit more as far as handing off the care of the other children to your partner, or if you have your parents around, that's really awesome that they can help too. But we're really strong, amazing women, but we don't have to do it all. So I think that that's really cool to know that too.
Yeah, that's awesome. So beautiful.
Yeah. So within that, what would you say are some of those like sticky points through labor and delivery that you find like are the most challenging for people who are, going through the unmedicated process? Where do you find like this is kind of where it tends to be those challenging moments? And then how do you kind of help people through that when you're
So there's two different spots here. One is if we're having a hospital birth. I think that coming into the hospital setting, usually if you're trying to do an unmedicated, usually moms will stay home a little bit longer. So when you're coming in, you're in active labor usually. And so doing all of those logical things like signing forms and, that can be really hard. And so that's usually a point where we're really advocating for mom on she's in a contraction. She'll be right back with you whenever she comes out of this. And we're creating that space for her. I think that once they get through that, a lot of moms are like, okay, I can just have this baby now that we're in the hospital and we're settled. And then at home, you really don't hit that point until you hit transition, which that's when you're doing that really quick, usually quick. Sometimes I know me, like my transition is a lot longer than normal. And so it's 30 minutes to like an hour, hour and a half. And that's when you're going from that 7 to 10 centimeters. And that's the most intense part. That's usually when we're like, okay, I definitely want this epidural. At home, I'll see moms kind of like pace in the tub of like, okay, how can I just run, just get out of this right now and not do this anymore?
Yeah.
And so those are those points where you really need that partner or that doula to be able to look at you and say, I see this as really hard for you. And I know that you will just want to get through this right now, but this is the hardest part. It's the quickest part. And you just have to take it one at a time. And we're right here with you. And just reminding them that we can do one contraction at a time. And each time it's intense, know that baby's getting closer. In the hospital, you hit that too. But I feel like there's kind of those two moments of like, because as you have more people asking you questions and kind of pulling you out of that labor land, and the contractions can feel more intense than they really are. Because you do have your senses are heightened. And so there is that kind of mama bear in you of like, is this safe? Do I need to stall labor? And so it's like, how can we move through getting into the hospital as easily as possible? And then let's shut out all the lights, I usually at OPR, I'll just put lights up in the tub in the bathroom while she's doing all of that with her husband. And then as soon as they leave, we're like, all right, we're getting in the tub. Like, we're just going to go in a dark room, and I'll have moms that will come in at like 5, 6, and they'll have their baby in like an hour or two after that,
Oh,
because they just needed to be left alone and in the dark,
yeah. Yeah.
and nobody bothering them. And
Yeah.
so, yeah, I think that just reminding them that they can do it. And I think educating the partner so that when they do see that moment in the mom where she's like, I cannot do this anymore, they know that they're going to experience that. So then that's when they can turn on like that strong masculine and just look at them and say, babe, you got this. Like, you can do this. You've done all these other ones. This baby's really close.
Yeah.
And that's sometimes all we need, is just to have our person be able to look at us and say, I know this is hard and I see you, but you can do this.
Yeah.
Yeah.
And so, yeah, and once mamas get through that transition, those contractions start to space out again. They're not right on top of each other. And you start to have that sensation to push, which I think for a lot of mamas can feel really good, of like, okay, there's no more relaxing. I get to like work with my body on this. And that can feel really productive too.
That's awesome. Yeah. That's really cool. And that's a good, I wish that it was easier to transition to the hospital. You would think that they would have it figured out, of like, women come in and are like in pain, and maybe forms can be done earlier. You know?
Yeah, I really do.
Yeah.
I wish that it was more easeful. But even as they've redone hospitals, they've just made it honestly more complicated.
Yeah.
And so a lot of that you can just say, I mean, I've had moms come in pretty far along to where we just don't do any of that. We just get going on having the baby.
Yeah.
And so, which I think also shows you that it's not
That
100% has to be done right now. Like, we can take our time. You can say, leave the forms there. We'll work through them as we are able to. And so we're always just, the dad and I are really looking at mom of like, okay, what does she have the capacity for right now? Where do we need to create space for her to say, we're not going to do this right now. We'll work on it in a little bit, but she's doing really hard work right now. And then other times, she kind of, once you've moved from home to hospital, you're kind of a little bit out of that labor land. So you're just like, let's get this done so I can get back into the zone of it.
Yeah.
And so I'll sense that sometimes with moms, and sometimes I'll be like, but you don't have to push through. Like, we can just take our time on this. And it's always the mom's choice of like how you want to navigate that. But I think just reminding them that we can go as slow as you want. Even walking from triage to the room, like, everybody is here waiting on you, which I think is hard for us as women to know that
Yeah.
everyone's there for us and we get to take up all the space and everyone's waiting on us hand and foot, and so to really be reminded, like, this is your experience. Literally everyone here is just for you. So we can take 30 minutes walking down this hallway, and that's not any problem. Like, we're all here for you.
Yeah.
So I think just reminding her that it's okay to take up space is really important.
Yeah. That's awesome. And hard, I'm sure.
It is. I mean, we're conditioned
Yeah.
not to take up space as
Yeah.
women. And so I think it's no accident that as we move through birth, a big part of that is taking up space, because as we become moms, we have to be able to take up space to advocate for our children and to make those really hard decisions and have hard conversations. So I think that it's all on the way. We really talk about that a lot in prenatals, of like, what is coming up, because usually those are the skills you're being asked to take on as you become a mom, and it's going to be different for everyone. Whether that's hard conversations with your parents about boundaries, or hard conversations with your partner, like knowing that those hard things are all on the way to setting you up for a postpartum and a motherhood that's really aligned and you can really just soften into.
Yeah. Yeah. I'm sure that looks different for like first time moms versus second and third time too. I just know how much you learn with that first experience of like, oh my gosh, okay, this is what I needed, or like, this was not great, or yeah. So that's cool. Do you see a lot of differences, or do you see mostly first time moms? Or I know for myself, I had a scheduled C-section because my daughter was breech, and I tell people all the time I didn't think I needed a doula because I was like, it just, you're walking into a surgery. But I think even in that scenario, there were so many things I just like didn't know and didn't know how to advocate for myself initially postpartum, and just all those like little things where I had worked in a hospital, so I didn't feel uncomfortable in a hospital setting, but um it's totally different as a patient and a first time mom and all of that. So I'm like, if I could, yeah, I would definitely go back and do that differently. But
Yeah.
so I think if I, yeah, I definitely
And
would.
I think that is with as we move through the first time, there's always going to be things that we look back hindsight of like, oh wow, I kind of would have done this a little
Sure.
differently.
Yeah.
And I think that, yeah, I think hiring the doula really helps in that because they do ask you those hard questions you
Yeah.
wouldn't really think of.
Mhm.
And that's also why when I do the class, I have like you get a one-on-one with me, even if you aren't a client, because I think that just having somebody, because I've had clients too, I actually have a lot of like second and third time moms that I will support that didn't have a doula the first time.
Kind of what I,
And honestly, those are some of my favorite clients
yeah.
because there's that sense of knowing of they understand this experience. And so there's almost more like fire in their belly of like, this is what I want and I am going for it. As
Yeah.
opposed to the first time you are much more hesitant because there's so much unknown and you're not quite sure how it will go. And so sometimes those second and third time moms, like, yeah, I just adore working with them because you get to see just all of these different areas where they're like, oh, well, this is really important and this is really important. And yeah, even just processing that first experience for them of like, okay, what were things that you wanted? How
Mhm.
could this have been differently? And also, that isn't your fault. Like, I think that a lot of us as women hold a lot of guilt about our birth experiences. And most of the mamas that I support for second and third time mamas, their experience was the system failed them. Like the system didn't care for them in a good way. And so that's where I'm like, you really, the education part and having a good supportive team is just absolutely key. And I think a lot of people, at least as I started out as a doula, it was like, oh, I'm not crunchy. Like, I don't want a doula because they're really, like, there's just such that, like,
Yeah. Yeah.
and
That's
it's
what
like,
people tell
oh
me, and I'm like,
no.
no, no, no.
It's like, no, like they're really that person that's not your mom, not your sister, not your best friend that is just going to come and hear you and also ask you those hard questions that kind of make you go, oh, well, I never thought of that before. And so they're able to kind of help you see things before you would naturally see them, if that makes sense.
Yeah.
And so that's what I've really loved is kind of in the last couple of years, I feel like doula is much more widely known and I even some of my clients are like, yeah, I didn't have a doula the first time because I was like, I'm not crunchy. I'm not going to do that. But after we had our class together and everything, she's like, absolutely 100% I would have a doula again. She's like, I didn't understand what it was, I guess.
Yeah. Yeah. I hear that a lot. No one, I tell people I've never heard anyone regretting having a doula.
Yeah.
So like I see a lot of people.
So I feel like a doula is really helpful, but I also want to say like sometimes parents create a really intimate experience. And so they don't want that extra person. And I get that. I didn't have a doula for my second. So that's why with the Mindfulness Childbirth Course, I always add on a one-on-one because I think that still having that person to ask those questions too. And then I also do free consults for potential clients. And then there's also, I do embodiment sessions, which are an hour long. And that can really be however the person needs it to be. It can be sort of like a prenatal where we go through all the things. It can also just be my body doesn't feel like my own in the season. And I really want help figuring out some practices to feel comfortable as I enter into birth. And then it can also just be a question and answer session of like, these are all my questions. I would want to ask a doula, but I don't want a doula. And so
Yeah.
I love offering that because I understand those people of I had a doula for my first, and then the second time I was like, I just wanted me and my husband. And I really love that. But then with Teddy, I had Lauren as my doula, and
Oh, yeah.
it just there's something about having that other woman there that can see you in those moments when you really want to be seen and kind of reorientate the room back to you.
Mm.
Um, that I just think that we, like you said, like we kind of think it's like healthy baby, healthy mom, and we look at the actual birth of the baby,
Yeah.
and it's like, no, it's this whole experience that's really important.
Yeah.
Um, because that's really going to shape how you feel about yourself as you enter motherhood. And I mean, that is why it's a rite of passage, is it's you kind of shedding away who you are as the woman and stepping into mom. And we want that to be done in love and care. And so that team is really important, whatever that looks like for you.
Yeah, that's really cool. Okay, so to recap, because I think, is there anything else, I guess, that you wanted to add? I want to go back through like kind of the different services you offer, just so if people, after hearing all of that, they can like process and be like, how do I work with Hannah? Because she's the best. But do you have any like advice or anything, I guess, last words of wisdom you would give someone if they're maybe even considering an unmedicated birth or considering a doula or just in pregnancy? I know that's kind of a big question, so it's also okay if you have like you've given us so much, so
I feel like just trusting that it's all on the way and trusting what feels really important to you.
yeah,
Because I think so many times in like blogs or articles, we'll see like, this is our checklist of all the things. And it's like, well, what about if those things don't feel important to me? Like, so really trusting, like if you feel gravitated towards this one childbirth course, or if you feel gravitated towards this one book, like really trusting that. And trusting that it's all in the way. And I think just cultivating that connection to your body, I think is huge,
yeah,
because,
yeah,
you know, anything that you kind of have been like, oh, I'm not going to deal with that now, whether it is back pain, anxiety, any of the things, pregnancy kind of just turns the volume up on all of that.
yeah,
Because it's saying, you know, you're stepping into motherhood. This is a really big deal. So we want to look at all of this. And decide how we're going to set ourselves up for this next season and what we also want to leave behind as we step into this next season. So I think body connection just would be probably number one, of taking all those sensations and not brushing them aside or saying, oh, it's just part of pregnancy, but really delving into them. I know like with Teddy, I think that was the big eye opener. I see it so much with clients. They'll have a specific symptom or something that was bothering them throughout, and they needed this thing, whether it was like breath work. For me, I had a ton of tailbone pain when I was pregnant with Teddy. And so that really deep squat felt so good. And so I would do it literally every night. And during labor, that was literally the only position that felt good for me. So his entire labor, I was just in a deep squat. And I was like, I am so thankful that I've been doing these every night for the last 9 months, because this didn't feel hard for me. My body was ready for it. And so I think trusting that your body is preparing you for your birth is really huge.
yeah.
Because we try to like force ourselves into all these boxes of how we want to prepare, and
Yeah.
it doesn't have to be that complicated.
Yeah, I totally agree with that. That's something that when people are like, what position is the best to birth in?
Right.
That's the first thing I talk about, is like, I'm like, you're gonna see all this stuff and like the best positions online. I'm like, we really just want to just ignore that and be like, what position right now, if I just asked you to get in a position that felt good, what position would you get in? And then we just kind of work from there. And then there's like, we can make minor adjustments, but that's so true, of just like what feels good to you.
Yeah, because I think
It does.
that's, the longer I've done this, the more in my head, because you know the positions, like you're like, okay, baby's probably here. This position will be good to like open up the pelvis in this way. And there's so many times when I just witness moms just get into that position. And so there's always part of me that's like, do I speak up? And I usually will just pause and wait and see if she moves into
Yep.
that. And then if I see that she's hitting a sticking point, then I'm like, okay, I see we're hitting a rough patch. Like, let's try this other position. And then I will be there to guide, but I'm always allowing her to figure that out for herself. Cause yeah, we really do. It's so crazy to watch women move through birth. And I'm like, you knew how to do it. Like, you really do. It's just, it's hard to shut out all that noise.
It is. I mean, that's what all the research, like the, randomized control, all the like heavy research just says, like, basically if you just leave people alone, they just kind of figure it out. And which I think is so cool. I mean, obviously we have intervention and help and everyone for a reason, but yeah.
I think
I
that
think
the step in my mind to get to that is what you've been talking about. Like, you have to trust
you
your
have
own
to
body. You
trust,
have
yeah.
to trust, like, my brain is telling me this, but I don't, I saw this
Yeah.
on the internet. That's probably more true. And then they second guess what their body, and I'm always like, your thoughts, your feeling, like how you're moving through this is probably the most accurate.
Yeah.
Like trust that. But if you haven't done like the work for the prior 9 months ahead of time, that feels really foreign and really scary to like trust themselves. So I can see how that makes sense for what you're kind of trying to teach.
Yeah. And I love that you even mentioned that you go through like the different positions with them, because I think that's so important to like, yes, you can see up on the wall, like these are good pushing positions, but you need to do them. Like you need to feel your body in there and feel where your body opens and feel where your body closes.
Yeah.
Because if you don't have that language of your body, then like you said, you will second guess yourself of like, I've never done that position. I don't know why I would want to do that position.
Yeah.
And so, yeah, we really talk about, in the Mindfulness Childbirth course of creating like cultivating movement. And we go over different movements. They could do a lot of non-linear movement. So a lot of like hip circles and a lot of like even just like lunging over the ball, just doing movement we wouldn't normally do to feel, how does this open up my pelvis? How does this allow tight parts to soften? Because yeah, there is that like cultivating your knowing within yourself, but then also understanding in your body what does feel good. And getting the partners involved in that. Like that's also my last thing. Like we will do comfort measures, and we'll do like shaking and show him massage and show him, okay, like if it's tight here, this is how we release that. Because then that allows them to build connection. Because sometimes as our body changes, our first reaction is like, don't touch me. I don't know what feels good. You don't know what feels good. And so in our prenatals and in the classic, we really talk about, okay, these are things that could feel good. They might not, but let's try them and let's open that conversation between the mom and dad so that they can get to know what feels good in her body, so that he can also feel really equipped to jump in there when he needs to.
Yeah. Participant. Yeah. I love that.
Yeah, because I can do all the things and help her with massage, but his touch is going to feel 100 times better than mine every single time.
Yeah.
So yeah, just bringing him along for the ride, I think, is absolutely key.
Love it. That's great. Okay. So to recap, you have like one-on-one that you could do like embodiment, is that correct? Or like consultation stuff, and then your childbirth course, and then obviously doula whole package. Is there other like things in there, or other things that are ways to do? Or is that
I set it up as in packages, and then they can also just get what they want. Usually once we meet for a consult, then it's really easy to see like, okay, this feels really good for you, this doesn't. I also started doing customized herbal support. So a lot of people now are seeing like the Nora tea and all these teas you can do. And so I've been training and still am with Aviva Ram on herbal medicine for women. And so what we're doing is we're saying, okay, these are really good herbs for pregnancy. We're educating you on that. And then you get monthly supply of those herbs throughout pregnancy. And then we can customize them. You know, if you're having some low grade anxiety, let's add a little bit of lemon balm in there. We're customizing it to what you're going through. And I really enjoyed that because I always did it for free. I would just make up the pregnancy teas and custom blend it and bring it. And I had this beautiful woman be like, well, how can I pay for that? And I was like, oh, that would be a really nice service. Like, let's actually do that. So it's really always my heart is like, how can I best set you up for this and not be a gatekeeper? Like, I want to educate you on like why we're doing this, how you can use these herbs for you and your family. And how all these skills you're building can also support you guys in this next chapter of parenthood. So you're very right. It's just the one-on-one, which can look anything like you want. The Mindfulness Childbirth course is mainly online. And then I do still do private ones. I don't teach them very often, but every once in a while, parents want me to teach the whole class in their home privately. And then birth support, which is 2 prenatals throughout the birth. And then we do a postpartum visit. And then postpartum support is usually 4-hour shifts. And then I have packages that kind of just bundle it all up together for whatever that looks like for you guys. So
that's awesome. Cool. Well, great. Well, thank you so much. This was so helpful for me. So I really appreciate your expertise and knowledge. And yeah, like I said, you can feel your calm energy even over the internet. So
it was lovely talking to you guys. It was good to connect.
Yeah.
All right.
Well, thank you.
We will see you soon.
Yeah, we'll see you guys. Take care.